Dr. Asti, could you please give a brief introduction on the topic of uterine fibroids?
Okay, no, thank you. So generally we will be talking about uterine fibroids, everything related to IVF. So the relevance of uterine fibroids in IVF setting. So first I will describe what uterine fibroid is, then I will explain impact of fibroids on your IVF treatment. So generally uterine fibroid means benign growth of the muscle layer of the uterus. So essentially uterus has got three layers. From outside, when you do laparoscopy, when you look uterus from outside, you have got a serosal layer. So then you have a muscle layer, then inside layer, which is endometrial layer. So generally, you have three different forms of fibroid. Subserosal, where the fibroid is protruding into the uterine, into the pelvic cavity from outside surface of the uterus. That's called subserosal fibroids. So second type of fibroids are intramural fibroids, where the fibroid is growing right in the wall of the uterus, in the muscle layer of the uterus. So the third type of fibroids are called submucosal fibroids. So these fibroids are protruding into the uterine cavity where implantation should take place, where the endometrial lining is. So it's very important to distinguish these forms of fibroid because they have got different implications to IVF treatment. So, for example, subserosal fibroids don't make much difference or very minimal impact to IVF treatment. Intramural fibroids can impact IVF treatment depending on a number of fibroids you have, size of the fibroids, and location of those fibroids. Then submucosal fibroids, which we really don't like because they can impact implantation significantly. So it's very important to establish what type of fibroid we're dealing with when we do IVF treatment. So generally in IVF setting, fibroids cause two different type of problems. First is reduces access to ovaries. Of course, we're interested in ovaries when we are doing stimulation. We are trying to produce good number of eggs by stimulation of follicles. So if access is not good, you may not be able to see the ovaries as well on ultrasound scan because fibroids can push uterus up. So scan beam, when you do transvaginal scan, may not reach the ovaries. So which means it reduces visibility. So which we call it poor access to the ovaries. Also, reduced access to ovaries can cause problem with egg collection because when you do egg collection, you don't want to have any distance between your needle and ovary. So normally, when you don't have a fibroids, so when you do internal scan during egg collection, when you put the needle through, it goes through straight from vagina to the ovary. So, but if you have a large fibroids or multiple fibroids, it can push uterus up. Because ovaries are attached to the ceiling of the uterus, if uterus is pushed, that means ovary is pushed as well. So it's pushed into the pelvic brim or even into the abdomen. So which means you may not be able to reach ovaries easily if you have a multiple fibroids. So yes, fibroids, depending on the size, may reduce access to the ovaries, which may make it monitoring during IVF and egg collection difficult. Second problem fibroids cause, which is much more significant problem, is fibroids can reduce the chance of implantation. So these are generally some intramural fibroids. If you have a lot of intramural fibroids which distorts the cavity of the uterus, or mainly submucosal fibroids. So where you have a submucosal fibroid which is protruding into the uterine cavity, that can reduce the chance. Let us say your age is 30, you have 40% chance of implantation with a high-grade embryos. Because of fibroid, your implantation can be reduced to 20%, for example. So you can still get pregnant, but it may be harder because of fibroids. So yes, fibroids in an IVF setting can cause two problems. They can reduce access to ovaries and also they can reduce the chance of implantation.